All right, it's a day of surgery. I've had like 2 hours sleep. Got my bag with all my meds, ugh, and waters and stuff. So let's go. Let's go do this. This should be fun. All right, now we're in the car, but I was thinking about getting a hotel because I've got like a doctor appointment near the hospital, what I thought was going to be a few hours after. So I almost got a room just for that. But turned out they scheduled me nicely, and so it'll be like out of operating room, recovery, and have time to get a bite to eat, and then head on over to the doctor's office, and that should work out very well. So timing is great. And then I haven't eaten since the day before yesterday, because I tend to get sick now. I used to be one of those types of people. I'd have surgery and I'd be like, go get me something to eat, go get my prescription filled. By the time you get back, I'll be ready to go. Well, not so much anymore. I struggle. So they're like, yeah, you're not having anything to eat for 24 hours plus before the surgery. So I'm hungry, very hungry, and my battery's about to die. So, but anyway, so I'm gonna get this plugged in. I'm very hungry, very ready to get this over with. So, but everything is gonna be better than I thought. So I don't know. When I had Lasix, they didn't give me any Valium or anything. They were supposed to, and then they rushed me, and I kind of panic freaked out, and there was a oh crap moment out of the doctor's mouth. So I get very nervous at the thought of this, but it's better than going blind. So I'm ready to go.
In a quarter mile.
All right, so here I am post-surgery. It took about 20 minutes. They were pretty quick. It was a trip. It was much different than Lasix. They put me back there. They gave me a little bit of propofol and I think Valium. Only had 2 hours sleep last night. It didn't make me pass out, and they want you alert. It was a trip. He put a dye in my eye, and that's numbed a dye. He put a numbing, and that has numbed my whole head. Like, I can feel my forehead and the side of my face. But I was saying it was kind of like they put these Benadine in the eye, and it's like you put food coloring in a glass of water, and it has those psychedelic kind of swirls. That's kind of what it was, a bit more of an orange hue, orange and brown. So he put that in after the numbing, and then he went to work, and that was kind of weird because then you could also see like this little tool coming in and snipping and stuff floating around, and then this little vacuum cleaner kind of sucking it up. And yeah, only pain I felt was probably a couple of pinchy kind of feel. It wasn't terrible pain. Maybe like a half, but it does kind of make your butt pucker up a little bit. I will confess to that. But maybe 6-7 times I felt that. Right now I'm in recovery. I'll be here for 30 minutes. I have to be face down. That is why we're at this odd angle. They put a gas bubble in your eye, and that's what keeps it back, I guess. So for 24 hours, I'll pretty much just be like this.
GPS signal lost.
Anyway, so that's where we are. Everything's good. I have to leave here and go directly to his office for post-op follow-up, and then I'll be back to see him in a week. And yeah, so I just have to take it very easy. No, lifting. It says back to work depending on your job, 2 to 4 weeks. So we'll see. I know they don't want you to do a lot of like recreational reading and stuff, so I probably won't be on YouTube too much at all in the coming weeks. So anyway, I hope this helps someone, and I'll continue doing my post-op follow-up little videos on this as well. But I do want to point out I did have an issue at LASIK where I twitched and the doctor said, "Oh crap." So going into the surgery, I had a bit of anxiety because of that, but hey, it was way easier than LASIK in my opinion. So thanks for watching. Take care, and yeah, take care of yourself. Listen to your body. I could have gone blind if I hadn't pursued what was going on here. So thanks for watching, and we'll see you later. Take it easy. Bye. Good morning. It's the day after, and at first I didn't wake up with too much pain, but your natural inclination to move your eyes together, that hurts. So I did take some Tylenol, and I'm getting ready to take my first round of antibiotic and prednisone in my eye. I take those like 5 minutes apart, and I'm ready to get this eye thing off. And I'm about to the point where I can, like in 5 hours, I can take off the cotton that's underneath the shield, and I can lay down, and I'm going to get comfortable. Again, the biggest pain that I've experienced is the eye. It's only like if I shift my eye, or I picked up a little bit of creamer, not even 5 pounds, and that kind of triggered a little pain. But the biggest pain has been in my neck. So from just the sleep position and everything. And I did wake up. I've had intermittent sleep, so I think I slept from maybe 8 to 1:30 this morning, and then I was up for a while. I don't know what time I went back to sleep, but I slept until, what time, Chris? 7:30?
Thereabouts.
7-ish, somewhere in there. So I've had a cup and a half of coffee almost, and I'm ready to get these drops in. So check in with you in a bit. All right, I've had drop number 1. Which was that, honey?
That was the
ciprofloxacin. So I had that, and then I did have like a little bit of blood on my gauze on my eye shield when I took that off, but I can see way better today. They took my my appointment yesterday post-op. They took my patch off and everything, and they were asking me like, "Can you see this? Can you see that? How many fingers am I holding up?" I couldn't see anything. Like I could see like shadowy figure, but today I can see a lot better, although it's still quite blurry. But I expect that to get better over time, especially now that I'm doing these drops and everything. So, and the reason my both eyes, like I said, it's painful if you have a tendency to move your eyes together. So I tend to just keep both eyes shut because it gets painful if I look at something and I shift my eye out of my right eye. I move my left eye with it, and yeah, it hurts a bit. So it's just easier for me to right now keep both eyes shut, and I do open my eye when I'm walking, obviously. It's pretty dependent on Chris initially yesterday with the surgery. I wasn't comfortable walking, so he aided me in that. And then, yeah, but today, I'm a little bit more comfortable walking on my own. So actually last night in the middle of the night when I got up at 1:30, I was doing that. So yay, progress. So check back in. All right, so I was able to remove the pad, and I am able to keep my head straight. But what I'm going to do is I'm going to try and get a really, really good nap. And now that I can lay on this side. It's the side I usually lay on anyway, and probably get some really good sleep for the first time in a couple of nights. So be back. Good morning. Here we are 2 days after surgery. My eyes not open very well. I just woke up. I've just had my first drop of ciprofloxacin, and then I have to do my prednisone drop next. That stings a little, but it's tolerable. It's certainly easier to have someone drop them in your eye, for certain. But yeah, we have a party to go to today, and I'll just wear my shield over there. They have some dogs, so you got to protect your eye from dust. Yes, I want to make sure to do that, and yeah, we should enjoy it. So I'll go over there for maybe a couple hours and come home. Not stay too long. They'll understand. They know. So they're like family to me. They're neighbors, so. But yeah, they were so sweet. They were going to bring me soup last night. I was like, girl, I cook for days. So. But yeah, day 2. Now, they say if your vision is declining to call immediately. Now, this morning it's not as good as it was right after surgery. However, I just woke up and my eye is a bit gummy. So hopefully taking those meds will help, and we shall see. But this is me. And I can't shower. You can't shower. You can't wash your face. You can't do any of that. You can use a cloth to wash it, but you can't get in the shower. So my hair will not be washed. It's a good thing they love me. But I'll wash my face before I go over there and take a lower body shower. But yeah, you can't wash until after you get your eye patch off. So a day. You have to go without showering, basically. But yeah, we'll see how the day goes. My neck feels so much better. I was able to sleep in my own bed. What time did you go to sleep, honey?
12:30ish.
12:30? Oh, that late?
Yeah.
Okay, so I went to bed around 12:30, and I got up once in the middle of the night, and I slept till 7:30, so it was delightful. I loved it. So nice to be back in bed. So anyway, follow-up coming soon. See you later. All right, so I'm back already. So I was playing back that video I just shot. I noticed there was blood dripping out of my eye a little bit. So I Googled, should you be bleeding 2 days after surgery? And yes, you can bleed up to a few weeks after surgery. So it's just if, you call the doctor if your pain gets worse. So my pain is intermittent. Again, it's still that if I shift my eyes kind of quickly or something, it'll have a little bit of pain, but it's not a constant pain. It feels the same as just after surgery, pretty much. So I think I'm good. I think my eye's a bit swollen today, but I did sleep on this side. So I'm not surprised that this would be swollen. So I think I'm good. I think I'm good. So yeah, don't worry about that. That is natural. That wasn't in any of my papers, which is another reason I'm doing this. So you know what to expect. so you don't freak out, so you don't get nervous. And, you know, my goal is, and oh, to my viewers, thank you so much. You're so kind. I was telling Chris today, I get overwhelmed with your kindness. It means a lot. Y'all are sweet. So, that being said, that's not why I'm doing the video at all. So, I'm just doing it so, I mean, my intention with or with YouTube is to always, you know, kind of help, educate, have fun, and enjoy your company, which I do immensely. So, that's my goal. But I don't want anyone worrying. And I know somebody reached out to me and said their friend's going to have the surgery soon. So hopefully this will help them know what to expect. So, oh, we have hummingbirds. I just saw a hummingbird out here. So sorry for the distraction, but I guess they're heading south. That one looked like a pretty fat one. It's not one that we've seen around here before. Just from the glimpse of it, it was a big one. So anyway, but yeah, don't be concerned if you have a little bleeding. It's if you have a lot of pain or if you notice pus. So, in the day of, I was getting some gunky stuff, and they said, "Oh, that's natural. That's your eye doing what your eye does." So, but yeah, I'm kind of looking at this. I kind of look like the guy from Kung Fu a little bit because of the redness, but I'm good. So, anyway, I'll see you later.